Greetings from Washington, D.C. This is Peter Thomas, the General Counsel of NAAOP. There's been a tremendous amount of regulatory activity in the first 2 weeks of the Trump administration, and it does impact orthotics, prosthetics, Medicare, and the Affordable Care Act. First, the President on January 20th, the day he was sworn in, issued an executive order involving regulations pertaining to the Affordable Care Act, and basically said that the federal government going forward, in particular 3 federal agencies, the IRS, the Department of Health and Human Services, and the Department of Labor, should interpret regulations to the maximum extent possible under law to be as least restrictive and financially burdensome as possible. He's trying to limit the financial burden on providers, patients, health plans, virtually all stakeholders in the healthcare space from the regulatory and statutory requirements of the Affordable Care Act. Now, whether or not that relaxation of regulations can occur without the departments going through regulatory rulemaking and adhering to the rules under the Administrative Procedures Act is pretty clear. The Administrative Procedures Act still applies, and the administration is going to need to adhere to that. And of course, any statutory language cannot be overridden by the department's interpretations. But this clearly will have an impact going forward on how the Affordable Care Act is implemented. The next directive that occurred came from the Chief of Staff, Reince Priebus, that went out to all department heads, and essentially on the same day, January 20th, that directive stated that all regulations that were pending to be published in the Federal Register had to be withdrawn pending further review by the new Trump administration officials, and that there would be a 60-day period by which any of those regulations that were ready to take effect would be postponed until the Trump administration reviewed those regs. That's across the entire federal government, not just Department of Health and Human Services. So those are 2 important changes. The next came on the 30th of January. It was another executive order, and it was designed to limit the fiscal impact of new regulations on business. It clearly will have an impact on Health and Human Services. The rule essentially says that if the federal government publishes a new regulation or proposes a new reg, that they must also rescind at least 2 regs in its place. And the cost of that new regulation cannot exceed how much the rescission of the other 2 total to. So in other words, it must be budget neutral or save the government money in order to issue new regulations. This is a very significant restriction on new regulatory activity, and will likely make regulations much more complex and complicated in order to get new regs published and implemented. Let me give you 2 quick examples. The off-the-shelf orthotics regulation, which was ultimately timely and appropriately brought through the regulatory process a few years back, dramatically expanded the definition of off-the-shelf orthotics from the statutory definition to a much broader regulatory definition. If that reg is ultimately rescinded in order to relieve fiscal burden on providers, that could be a very positive step for the O&P community. In a sense, or in essence, the federal government, if they do decide to expose off-the-shelf orthotics to competitive bidding in the future, they would have to rely on the statutory definition, which simply states that an orthosis is off the shelf if it only requires minimal self-adjustment. The regulation had expanded it to orthoses that also could be provided or assisted by a caretaker or by a supplier. Second example is BIPA Section 427, the regulation that is in proposed rule form now, comments for which are due in March 13th, the middle of March. This is a regulation that the O&P field has been looking to get proposed and finalized for years and years, and unfortunately it wasn't able to be finalized before the Obama administration left office. This is going to be more difficult now to get into final form and to get finally published. Doesn't mean it won't happen, and NAAOP and its sister alliance organizations will be actively pursuing the publication of a final rule in this area. But this regulatory activity will clearly be an additional challenge. The Office of Management and Budget is expected to issue additional detail on all of these regulatory changes, and we will be sure to bring that to your attention as soon as it comes publicly available. Thank you.